I decided to pursue surgical oncology because when I interacted with those patients, I felt like they were the ones that needed help the most. My name is Bill Morano. I'm a surgical oncologist at Mainline Health. I can offer robotic approaches for cancer surgeries for things like metastasis to the liver, pancreas cancers, gastric cancers, esophageal cancers, colon and rectal cancers, tumors in the retroperitoneum like adrenal cancers. The advantages of doing a minimally invasive procedure are that there's generally less pain for the patient afterwards. There's a quicker recovery so that we can get patients up and get them moving. It's inherently an academic specialty. It's multidisciplinary. I meet with medical oncologists, radiation oncologists, and we meet as a team every week to discuss treatment for individual patients, so we make sure we're tailoring therapy to them specifically. I have to constantly read and keep up with the newest trials, the newest treatments, and the newest surgeries to make sure I'm offering them up-to-date evidence-based medicine. Surgery isn't always the first option for someone with cancer, and in fact, a lot of cases, it's not. But I think it's important for me to meet with the patients to talk to them about why that's the case, why surgery isn't indicated right now, why it may be in the future. The way I like to take care of my patients is how I would hope another physician would take care of my family. So I want to make sure that I'm giving them all the information they need, that they understand everything as best they can, so that they trust that we're going to work together through this. When you come to a place like Mainline Health for cancer treatment, you'll also interact with nurse practitioners, nurse navigators, and their role is to, especially the nurse navigators, is to help guide the patient through their treatment because it gets complicated. And sometimes they need somebody, a point person that they can call and talk to about where they're supposed to be, who they're supposed to be, and when, so they don't miss anything. I think what's exciting about the future of cancer care is that it's constantly evolving. Immunotherapy is being used more and more for different types of cancer. It relies on clinical trial data to tell us when it's applicable. There are new surgeries coming out for patients with gastric cancer and colon cancer and appendiceal cancer that allow them to recover quicker and have longer survival. There's a lot of treatments that may mean surgery isn't necessary, and that's great. I think probably what's most important is screening, to catch cancer before it develops and to avoid a surgery, to make sure we're treating the patient before it becomes a big problem for them.